Welcome to Pharma Knowledge, your go-to channel for understanding medical terms and healthcare concepts. In the world of medicine, terminology is key to accurate communication. Let's break down complex medical language to make it easy for you to understand. Immune system, the way the body defends itself against infection, disease, and outside substances. Immunotherapy treatment to prevent or change the response of the immune system. Implantation, the process through which an embryo attaches to the lining of the womb. In vitro fertilization, IVF, a technique where eggs are collected from a woman and fertilized with a man's sperm outside the body. Incomplete miscarriage, when a miscarriage has started but some tissue remains in the uterus. Incontinence, not having full control over the bladder and/or bowel. Induction of labor, when labor is started artificially. Infectious conditions which can be passed from person to person by microorganisms like viruses or bacteria. Inflammation, a bodily response in which white blood cells and other immune cells protect your body from disease or injury. Infusion, a way of putting a drug or fluid into the bloodstream through a needle at a steady rate over a period of time. Intensive care unit, a specialist unit within a hospital that provides extra care for seriously ill people. Interstitial cystitis, inflammation of the bladder wall. Intrapartum, during birth. Intrauterine contraceptive device, IUCD, a small device fitted into the womb to prevent conception. Invasive, a medical procedure when a cut is made to the body or an instrument is inserted. Irritable bowel syndrome, IBS, a chronic disorder involving abdominal pain, bloating, and changes in bowel habits, such as diarrhea. It is caused by an overactive bowel. Karyotype, a record of the complete set of your chromosomes. Karyotyping, a procedure to produce a karyotype using a blood or tissue sample. It is used to check for abnormalities in the chromosomes. Ketones, an acid remaining when the body burns its own fat. It is often a sign of dehydration and can be tested by a blood or urine test. Clumps paralysis, reduced movement in the baby's arm from damage to nerves in the baby's neck. Laparoscopic ovarian drilling/diathermy, a surgical treatment for polycystic ovary syndrome to improve irregular periods. Labor, the stages of childbirth. Labor is divided into 3 stages, first, second, and third. Laparoscopy, keyhole surgery involving up to 4 small cuts in the abdomen. Laparotomy, a cut up to 14 inches long, giving surgeons access to the abdomen. Laxatives, medication to open bowels, libido, sexual desire. Lupus, a long-term health condition which mainly causes joint pain, skin rashes, and rarely kidney problems. Lynch syndrome, also known as hereditary non-polyposis colorectal cancer, HNPCC, is a type of inherited cancer syndrome associated with a genetic predisposition to different cancer types. Meconium, the poo that your baby does when they are first born, it is black and sticky like tar. Medical abortion, a way of ending a pregnancy by using medicines. Meningitis, inflammation in the brain caused by a virus or bacteria. Menopause, the time when a woman's periods stop, usually around 50 years of age. Meta-analysis, a way of combining and contrasting results from different studies with the aim of finding underlying patterns common to all. Miscarriage, the unplanned loss of a pregnancy before 23 weeks. Molar pregnancy, a rare condition where the placenta overgrows and the embryo does not form correctly. Musculoskeletal, the body's support structure, the bones, ligaments, joints, and muscles. Neonatologist, a doctor who specializes in caring for newborn babies. Neural tube defects, abnormalities of the skull or backbone of a developing baby that happen during the first 12 weeks of your pregnancy and which will affect your baby from birth. Obstetrician, a doctor who specializes in the care of pregnant women. Edema, swelling in any part of the body. Oligohydramnios, too little fluid, amniotic fluid, surrounding the baby in the uterus. Oocyte donation, when eggs are donated to help another woman become pregnant. Os, the opening of the cervix, ovaries. A pair of organs, each about the size of an almond, in a woman's pelvis. They produce follicles from which eggs develop. Ovulation, the process by which the ovaries produce and release an egg each month. Ovulation usually takes place around 10 to 16 days before a period. Oxytocin drugs that stimulate the womb to contract. Peer review, an assessment of the content and quality of a report or body of research by a group of individuals who have a range of expertise in a particular field. Pediatrician, a doctor who specializes in the care of babies, children and teenagers. Pelvic congestion, swollen pelvic veins, pelvic inflammatory disease, PID, an infection in the womb, fallopian tubes and/or pelvis caused by infections such as chlamydia and gonorrhea. Perineal tear, when the perineum, area between your vaginal opening and anus, tears during childbirth. Perineum, the area of skin between the vagina and the anus. Peritoneum, the tissue that lines the abdominal wall and covers most of the organs in the abdomen. Pessaries, a medication or device which is placed in the vagina. Physiotherapy, special exercises and physical activities to improve body function and strength. Pituitary gland, a gland in the brain that produces hormones. Placenta, an organ which develops in the womb, linking the baby with the mother's system. Placenta accreta, when the placenta is attached to the muscle of the womb and does not come away properly after the birth. Platelet, specialized cells necessary for blood clotting. Polycystic ovaries, ovaries which have at least twice as many developing follicles as normal ovaries in the early part of the menstrual cycle. Polycystic ovary syndrome, PCOS, a condition which can affect a woman's menstrual cycle, fertility, hormones, and aspects of her appearance. Polyhydramnios, too much fluid, amniotic fluid, surrounding the baby in the uterus. Polyp, a growth of tissue arising from the lining layer of an organ of your body. Post-mortem, a medical examination of the body to find a cause of death. Postnatal, the baby's condition after birth. Postnatal depression, a type of depression parents have after the birth of their babies. Postpartum, the mother's condition after childbirth. Postpartum hemorrhage, heavy blood loss after the delivery of the baby. Pregnancy test, a test on a sample of urine or blood to confirm whether a woman is pregnant. Premature birth, preterm birth, when your baby is born before 37 completed weeks of pregnancy. Preterm labor that happens before 37 weeks of pregnancy. Progesterone, a hormone produced as a result of ovulation. Prolactin, the hormone, which is responsible for producing breast milk. Prolapse, where the bladder, womb or bowel pushes through the wall of the vagina. Prostaglandin, the hormone that makes the womb contract during labor. Proteinuria, protein in the urine. Pudendal blocker, local anesthetic injection inside the vagina. Pulmonary embolus, part of a blood clot, DVT, which breaks off and travels in the bloodstream and becomes stuck in the lung. Rectocele, when the rectum bulges into the weakened wall of the vagina. A lump may be seen or felt. Rectum, the part of the large intestine which stores solid waste until it leaves the body through the anus. Recurrent miscarriage, when a woman loses 3 or more babies before 23 completed weeks. Reproductive organs, the parts of the male and female body needed to create and sustain a pregnancy. Retrovirus, a type of virus. HIV is a retrovirus. See also HAART and antiretroviral therapy. RHD antigen, a protein on the red blood cells of 85% of people in the UK. These people are known as RHD positive. People who do not have the protein are described as RHD negative. Second-degree tear, a tear during childbirth, which affects the muscle of the perineum as well as the skin, and usually requiring stitches. Second stage of labor, the period when the cervix is fully dilated until the birth. This is the time when the woman will start pushing. Semen, the fluid that contains sperm. Sepsis, the immune system's overreaction to an infection or injury, which can lead to tissue damage, organ failure, and death. Sexually transmitted infection, STI, an infection that is passed on through close physical contact during sex. Shoulder dystocia, a situation during birth when the baby's head has been born, but one of the shoulders becomes stuck behind the mother's pelvic bone, preventing the birth of the baby's body. Sickle cell disease, SCD, an inherited condition in which red blood cells, which carry oxygen around the body, develop abnormally. Sonographer, a healthcare professional who uses ultrasound equipment to scan your baby in order to check their growth and development. Speculum, a plastic or metal instrument used to separate the walls of the vagina to show or reach the cervix. Spina bifida, a condition which affects the unborn baby in the early stages of pregnancy. Spina bifida causes damage to the spinal cord and nerves. Spinal anesthesia, an anesthetic injection into the lower back that numbs the lower body so surgery can be carried out in this area without you feeling any pain. Spontaneous vaginal birth, the natural birth of a baby through the vaginal canal without assistance. Sporadic, a one-off event, stillbirth, when a baby is born dead after the 23rd completed week of pregnancy. Stress incontinence, leaking urine during everyday activities like coughing, laughing, or exercising. Succenturial lobe, an additional piece of placenta connected by membranes. Sutures, stitches which may dissolve or remain within the body permanently. Symphysis fundal height, a measure of the size of the uterus used to monitor a baby's growth and development during pregnancy. Thrombophilia, a blood clotting abnormality which tends to run in families, whereby the blood is more likely to clot than usual. Tachycardia, a rapid heartbeat. Tampon, a tube of absorbent material that fits into the vagina to absorb the menstrual blood. Temperature, the degree of hotness or coldness of a body or an environment. Third-degree tear, a tear during childbirth, which extends downwards from the vaginal wall and perineum to the anal sphincter, the muscle that controls the anus. Threatened miscarriage bleeding before 24 weeks of pregnancy, which occurs without harm to the baby. Thrombosis, a clot in a blood vessel. Tocolysis treatments used to delay or prevent early labor. Toxoplasmosis, a common infection caused by a parasite which can be found in undercooked meats and the poo of infected cats. Tubal occlusion, an operation which blocks, seals, or cuts the fallopian tubes. Ultrasound high-frequency sound waves used to provide images of the body, tissues, and internal organs. Umbilical cord, umbilicus, the cord that connects a mother's blood system with a baby's through its navel and which is cut after the birth. Urethral, when the tissues that hold the urethra in place weaken, causing it to move and put pressure on the vagina, sometimes pushing through the wall of the vagina. Urodynamics, tests to assess how the bladder is working. Uterine rupture. This is when the muscle of your uterus, womb, tears, usually because of contractions while you are in labor. Uterine sarcoma, a disease in which malignant, cancer cells form in the muscles of the uterus or other tissues that support the uterus rather than the lining of the womb, as in the case of uterine carcinoma. Vagina, the canal leading from the vulva to the cervix. Vaginal discharge, any vaginal secretion except menstrual bleeding. Vaginal examination, internal A-check to feel the size and position of the vagina and cervix. Vaginal swab, similar to a cotton bud, but smaller and rounder. Some have a small plastic loop at the end instead of a cotton tip. It is wiped over the vagina to collect samples of fluid to check for infection. Vaginal thrush, an infection caused by a yeast known as Candida albicans. Varicella, the medical name for chickenpox. Vas deferens, the tube which carries sperm from the testicles to the penis. Vasectomy, a permanent method of contraception for men. Vein, a blood vessel that takes blood towards the heart. Velamentous cord insertion. Normally, the umbilical cord inserts into the center of the placenta. Velamentous cord insertion is when it runs through the membranes before reaching the placenta. Venous thrombosis, a blood clot that forms in a vein. Venous delivery, a way of helping deliver a baby by using suction through a special cup placed on the baby's head. Virus A, microorganism, which invades living cells in order to grow or reproduce. Vulva, the area surrounding the opening of the vagina. It includes the inner and outer vaginal lips, the labia, and the clitoris. Weak cervix. When the cervix opens too early in pregnancy, in the second trimester, and without contractions. Used to be known as incompetent cervix. White cell cells in the lymphatic and blood systems of the body which fight infection. White cell counter count to measure the number of white blood cells. Womb, the organ where a baby develops during pregnancy. Yersinia, a type of bacteria that can cause diseases like the plague, and yellow fever is a viral disease transmitted by mosquitoes. Zoonotic diseases, infections that can spread from animals to humans, and zinc deficiency can affect the immune system. Thanks for watching. Don't forget to like, share and subscribe.